been a while since I've been up here, and so it's great to see all the Auckland faces again. If you don't know who I am, Dr. Peter Blakey, formerly NZVA President, formerly RX Vet founder, and now founder of GLA Pharma. Just a quick couple of intro things. So toilets, for those that don't know, are out there. The exits are out that way. So the plan for the night is I'll just do a quick intro to GLA Pharma. Dr. Jess Beer, we have the pleasure of her speaking on pre-clinic Waihibi drugs for Waihibi visits. So I'm sure that'll be an excellent talk with some really good tips for you guys in practice. I then just talk briefly about our new product, Sileo, which you may or may not have heard. And then Kim, our National Key Account Manager, who you probably all know, she's been in Auckland for a long time. Just give a quick 2 or 3 minutes on the products we've got and have just recently launched. So who's GLA Pharma? So there's 4 of us in the team, myself, Danielle, our marketing person, Kim, who I've introduced before, and we've got Jean down in Wellington doing our regulatory work, which at the moment is quite a bit. So we exist basically to try and provide you guys with novel and unique products for companion animals. Having worked previously in the UK, I recognised that there was a massive gap between what products were available in the UK versus what were available here, and I thought, well, we've got to do something about that. Having worked for a big corporate pharma, I know that there's a certain turnover or revenue line that these products have to meet, and often they just can't justify them in New Zealand. So that's where we step in. So we've got 4 different companies' products at the moment. We've got the Derm Care range, of course. We've just got the Sileo, and we have another couple, BFR, which is our new pheromone range we'll talk about briefly soon. And we've also got a new dental range from Animal Care and a bunch of other products that will be coming out over the next few months. So that's us. So without further ado, I'd like to introduce Dr. Jess Beer. She's probably no stranger to you. Jess qualified from Massey in 2002 and then went to work in the UK for about 10 years in companion animal practice. Then got her membership for veterinary behaviour in 2014. So she currently works in both general practice and specialty practice, for specialising in behaviour problems, obviously, and she's based in Green Lane, so just up the road. Her goal is to help prevent behaviour problems with appropriate behaviour advice on training and environmental management. She's also keen to educate and support vets and clinic staff in general practice with the enigma that is behaviour. So, and tonight, Jess is going to talk about managing anxiety in animals when visiting the clinic. Go, Jess.
I do need to plug in. Where is our... there we go. Sorry, bear with the technical... and then we are recording this evening as well, so what have we got? I'm going to adjust these lights a little bit as well because it is quite hot. Can you hear me on the mic? No. Can you hear me on the mic? No? No. Is that better? No. I have it unmuted it. There we go. That's better. Okay. Just going to turn these down a little bit. Brilliant. Hey, it's up. Fabulous. So thank you very much, GLA Pharma, for inviting me to talk. I like to talk a lot. And this topic in particular, I think, quiet in the front row, thank you, Ali, is probably the most common question I get. So I have been trying to introduce how to decrease the stress of our pets coming to the vet clinic. It's just so valuable for both the pets, for their guardians, and for the safety of our veterinary clinics. And then obviously we've had a recent increase in the use of medication, and that's usually what people ask me. Now, I don't have a magic gold cure of exactly what you should do that will solve all your problems. It doesn't really exist. With these kind of questions, I do commonly feel like behaviour in particular really leans into the art of veterinary science rather than the science. So it is important to manage your expectations, and hopefully after today, you've got a bit of a better idea on how these drugs work and why you would then choose them for your particular patient. Mostly focusing on dogs, and I think that reason is probably because they're the ones who bite us more often and make a big show about it. But technically, I believe more injuries are caused by cats. So we're going to talk a little bit about drugs and probably open up the window to identify other areas in your practice that you might want to work on. So this is from a lot of my talks about why it is so important to talk about managing the stress of our patients. We often don't even see these patients, particularly cats, because clients don't like bringing them to us. They're like, oh, it's really stressful, or you won't be able to touch them. And so therefore they don't get that really necessary veterinary care, both preventative and treatments. When they're scared, they often resort to aggression. Now, I think it's safe to say that most vets have probably lost their ability to assess certain normal behaviours because the majority of pets we see are in a significant state of stress. That stress is going to compromise healing. It's going to significantly compromise our ability to diagnose and even touch these animals, let alone get a decent idea of exactly what's going on. And it's been pointed out there've been more and more studies coming through, Fear-Free Pets in particular identified in a small study, but it's easy to repeat, 60% of owners report that their dogs are stressed just entering the vet clinic. This is before we do anything to them. So we know it's a big topic. We know it's an area that we really do need to work on, and hopefully we can give you some ideas on how you could do that. Before they even get to your clinic, they are feeling fear and stress. Now, this could be due to their caregiver. I saw a recent TikTok reel, whatever it was, and the drama of that morning for the family was so-and-so has to take the cat to the vet. And you followed the progress of them trying to sneak up behind and catch it because they are already nervous about the whole process. Are they afraid of the crate or the carrier? I think it's safe to say the biggest improvement you can make to your cat's quality of life is carrier train them so that they're comfortable in that carrier, in that crate. It plays a huge role in reducing their fear and anxiety for the whole process. Is it the travel? Is it getting in the car? There's plenty of dogs who are fearful of the car. They only go in the car when something bad is going to happen. And then obviously if they're going to a vet clinic and this process is occurring, have they had fearful experiences before? So they have an emotional memory that is setting them up to feel really terrified. Two very, very useful courses of education would be Sophia Yin, Low Stress Handling. She has a website, she no longer, but her team, Cattle Dog Publishing, amazing, and you can do courses both species specific and specific handling techniques. And then of course we have the Fear-Free. Anyone here who is Fear-Free accredited? Yeah, not many. So it's relatively new in New Zealand. It's been big in the States for a while, but it is basically creating a whole philosophy on reducing fear. Now, I think it's safe to say that fear-free doesn't really exist. Life is not fear-free, but it's a nice lofty goal to aim for, to reduce the fear in our pets. This is from Fear-Free Pets. Certainly you can look on there for your own education, but if you have clients who are keen, and I am going to touch on how having your clients involved in this whole process will make a big difference. Fear-Free Pets, and this is where we're introducing that fear, anxiety, and stress and what the spectrum could be. And the reality is, I would say the majority of dogs are in yellow or even red when they come and visit us. And there are similar spectrums that you can look at in regards to cats. So again, anyone here, I'm happy to see some of the softwares introducing a behavioral score on your templates or on your consultation. Is anyone using those? So when you have your template, good, we've got a few there, fabulous. The templates are of what's their weight, what's their heart rate, what's their temperature. Why are we not strongly identifying what their behavioral signs are and what their anxiety level is? So that not only can we track their improvements, but you are forewarning your colleagues who come in to deal with this. We don't just want these negative connotations of will bite, very aggressive, angry, spicy cat. The terminology and the language we use changes our empathy and it changes how we manage them. So instead highlighting how they feel about it, what is their fear and anxiety and stress code? You could color code it, you could use numbers, but it's a good idea to start incorporating a behavioral awareness into our consults. So moving towards more specifics, when we're talking about improving veterinary visits for everyone involved, it starts before they even come to the clinic. And this is one of the things we're having our reception staff and our nursing staff involved in the process. It's going to make a really big difference to forewarning clients on what we can offer to make the whole experience not necessarily pleasurable, but tolerable. The arrival and reception. So nowadays we do have more feline-friendly clinics, which is good. So we're starting to target, hey, maybe dogs and cats shouldn't be sitting next to each other. Because if you look at all the things, if you walk into your room, pretend you're a dog, look and smell and hear and evaluate all the things that might be contributing to stress. And if we realize they're already stressed before they come in, and last time they were in, they had diarrhea and a thermometer up their bum, they're already ready to hate this place. And you throw in more angry pheromones from previous patients, or the chemicals that they've associated with things. All of these triggers are elevating their fear, anxiety, and stress score. Then we have the consult room. Unfortunately, we don't have very well-designed consult rooms, particularly for dogs in regards to cornering them. They're often quite small. Do you look at the way it's set up? Where is the table? Where are you facing them? Are you waiting there while they come in? Are you leading them in? Are they worried about the doorway? All of these things are going to impact on how they feel before you even look at them, let alone touch them. Then we have the examination process themselves. Has anyone here actually been injured in the course of their work by an animal? Absolutely. It is part of our job, but it's not an acceptable inevitability. And I think given the past couple of years and the dramas that we have seen in New Zealand, it's important that we start working out ways that we can protect ourselves. Recognizing that the way we handle these animals plays a huge role in how they're going to respond. Now, if they're already painful, let's avoid the painful bit till we get there. So when I went to vet school, it was you start tip of the nose to tip of the tail, and that's how you perform an examination, and you must do a TPR on all these animals. The reality is following those steps without paying attention to how the animal feels about it is setting them up to feel fearful, anxious, and potentially aggressive. Then we have things like admission. So, for example, if the animal has come in and you require tests to be done, are you automatically removing those patients from the room, taking them to another area? Studies are now showing that the level of stress response, be that cortisol or behavioral signs of stress, is elevated the moment they go into that communal prep area. One of the easiest things you can do is remain in the room that they were in, particularly cats, but also dogs. You bring them into a large community prep room, there are a lot of other noises, there's doors banging, there's other species. Why are we making the whole process harder for everyone? Just because that's how it was done? It doesn't need to be. So admission process, again, have you brought them in, you've done tests, then decided you need to admit them, they move to another room. We're adding layers upon layers of triggers to amplify how they feel. By the time your nurses go into pre-med and pop a catheter in, that dog is not coping. And there are ways that we can avoid that. Hospitalization, hopefully separate dog and cat rabbit wards, separated so that they're not dealing with the threat of another species at the same time. If they're staying for a long period of time, are there things you can do to make their stay more comfortable? We know that chronic stress or elevated stress will delay healing. And more importantly, from an emotional point of view, they're going to remember they had a really terrible time with you guys, and why would they want to come back? Discharge. Are there ways you can do that to make it more comfortable? I've often seen routine discharges where you're out in the reception area with the dog, post-spay, talking to the client, with the nurse about all the information. And they've just had surgery. They're painful, they're disorientated, they're nauseous. I say that loud? And you've got them in an environment that is adding to their stress and adding to their emotional memory of the experience that they had with you. Just going to give it a drink. I'm talking too much. So as we've mentioned, medications is probably the biggest question that I get, because a lot of people think it's the quickest fix for them. It's not really, but it's a great tool to add into our toolbox. And why would we use it? Not to sedate away the aggression. We are using it to reduce the patient's fear, anxiety, and stress. We're reducing the need for higher levels of sedation and anesthetic doses. Anyone found by the time they've got the Domitor into the aggressive bucking dog, they actually need 3 times the dose to have the effect. It reduces client stress, and it's going to increase their cooperation in our recommendations. I think one of the simplest solutions is to say, if we prove to you that we care about your pet, you're going to trust us. If they come in and their pet has a terrible experience with us, I've had a lot of people who've said to me, I didn't like that last vet, or the vet I went to, they weren't very nice, they looked at my dog wrong. Now, you may think you've done everything medically, but the perception you give to those clients is going to impact whether they trust your decisions and your recommendations, whether they come back and see you again. Absolutely improving staff safely and handling. And putting all that together, we're going to improve their future visits. A lot of the time, and I think this is less of a case than it used to be, they come in and the vet is, I have to get the job done. They don't realize that doing that to a 6 or 12-month pet could affect the rest of that pet's life experience in vet clinics. I'm really, really keen to see a way that we can improve our desexing processes because it is considered one of the more traumatic events. It is occurring in a fair period of these young adolescent dogs. And I wish there was some nice, easy ways that we can resolve that. And I would probably just throw out that benzos are a really good idea for those surgeries, those anesthetics, and those patients. But you often have, they loved it coming in as puppies. They tolerated the vaccination, they tolerated the worming, but after desexing, never want to enter the room again. So let's look at ways we can improve their experience. So this is probably what you're all after. I've got 2 little slides here, which is basically listing the range of medications that we can use as pre-visit pharmaceuticals. So feel free to take a picture. And if you look at the bottom, it is actually from, I'll just see if I can move that screen share, from an article that you could look up yourself. Today's Veterinary Nurse. I've actually found some really useful articles from that publication, and I just want to give a shout out to all our amazing nurses who have, I think, without a doubt, led the forefront of behavioural care and empathy for our patients. So thank you. So the ones I have there in yellow are the alternatives that weren't mentioned in this original tableau, which I think is a UK-based one. So gabapentins, we also have pregabalin. Alprazolam or Xanax, unfortunately, we can't access in New Zealand, and it is probably the most often quoted one for reducing fear and anxiety. And Sileo does get a mention at the bottom. So this is just mentioning the indications and the possible adverse effects. I'm going to go into them all in a little bit more detail. There we have some doses. So this was also, I cannot recall, I apologize, where I got these doses from. As you can see, there is a range. And this is where the art of using pre-visit pharmaceuticals comes in. There is no one dose that will do the trick for every single animal. And I'll probably mention it a few times. If you're going to be using pre-visit pharmaceuticals, they must do a test dose before they come to the clinic. Otherwise, you get the, oh, that didn't work, it failed. Oh, I didn't like the effect that had on my pet. I personally prefer to start low and then titrate up to the optimal effect. And the way I explain that to clients is your pet should be relaxed and sleepy, but rousable. They might be a little bit wobbly, but if I have a strong level of ataxia, it's actually too much. And they often lose their facilities to moderate their own emotions. And I sometimes find they're actually more likely to explode because they feel unsafe. So we have mentioned cats there as well. 2 little notes there. Trazodone, this was an older slide. We can actually use trazodone in cats. It seems to be working extremely well. And I understand the doses are around 10 mg per kg. The diazepam, risk of hepatic necrosis, all our internal medicines will say do not use diazepam. Yes, sorry, question. Yes, we can. Good question. The majority of people are getting it compounded via Optimus, or there are actually a few other compounding labs in Auckland that you can use. And I understand a colleague of mine is looking at importing it as well. I don't know where we're at with that, so I can't reveal anything. But yes, you can get trazodone. It's not cheap. So my colleagues overseas use it all the time, regularly, long term, and it's considered easy and safe, but incredibly expensive. So you're looking, there we go. That's what I've heard as well. Compound labs. Right. So absolutely, we can get trazodone. Yes. 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 I'll let the team, yes. Basically, I would say yes. But as with any medication recommendations, you have the discussion with the client, you weigh up the pros and cons, and you determine. It's an absolute lifesaver for a lot of patients of my colleagues overseas, particularly for fireworks and thunderstorms, which is exactly what it is licensed for. I'll be mentioning now as a pre-visit medication. It is off-label, but it is beginning to be used, and there are studies that support the use of it. Smaller dogs, yes, far more cost-effective. But again, if it's the difference between your dog escaping and destroying and ripping their face off, trying to get away from the fireworks, it's worth it for a lot of people. And certainly with insurance nowadays, it's an option that we should be considering. Yes, so yeah, we have those drugs there as well, a couple of different benzos. The trazodone we can use in cats. And then the diazepam, my behaviour colleagues are actually quite happy to use it orally, but there is that risk of hepatic necrosis, which has occurred in the past. Okay, so let's touch base on each of these. Gabapentinoids. So these are analogues of GABA, but they're not actually acting on GABA. So what they're doing is affecting those calcium channels to just calm those nerves down. And that's why we see it working well for chronic pain. Pain is stimulated by those nociceptors firing, telling the brain that they're painful. But it also works on the fear nerves firing away in the brain. I am not a pharmacologist, so it is not my forte. I hated it at vet school, but I have had to learn a little bit to understand the drugs that I'm using, primarily off-label. We pretty much only have Comicum here registered for behaviour in New Zealand. It's very old school, and I really don't use it very much. We've got some doses there. The two main gabapentinoids we would use is gabapentin that we're pretty much all very familiar with, and certainly the NZVA announced that they were comfortable with us dispensing this without seeing the pet first to reduce the level of fear and anxiety with aggressive dogs. And post-COVID, there's been a massive increase of those particular dogs. Pregabalin, game changer. I love it. It works faster, it tastes better, and it's smoother. I don't tend to have the same level of sedation. I see more calmness. It has the added effect of often increasing their appetite a little bit as well, which is great for behavior modification and counter conditioning. And basically, yeah, go for it. It also has a much smaller dose range. So if you look at GABA, we're looking at 10 to 40 mg per kg. Now, nerve pain, they often recommend it at 5 mg per kg. I've heard of people using up to 80 mg per kilogram. Massive dose range. How are we supposed to decide what is appropriate for our particular patient? So that's why we're often going for pregabalin. And it's also a nice price range as well. What we're doing here with these particular ones is often giving it the night before as well as the morning. So the key with pre-visit pharmaceuticals is determining the timing to get that sweet spot. And what we are finding with the GABAs in particular is you have it on the night before and then repeat in the morning. It just seems to be smoother and more effective and more reliable as to when the onset occurs. And as you can see with gabapentin, we've got about 1 to 2 hours onset and approximately 8 to 12 hours duration. But the sweet spot for us to do things to that animal could be anywhere in that time range, unfortunately. Pregabalin, I tend to find a little bit more reliable within that first hour, and they stay nice and smooth for a good 8 hours. At the bottom, we do have mild adverse effects, which is something we need to be aware of. Sedation, obviously. Now, the majority of these medications, that's actually what we want to a certain degree. I have seen urinary incontinence in higher doses, and occasionally you can have agitation. So a few of my cases, given the increased caseload I've had in the last year, I am starting to see a few more who say, actually on gabapentin, they're worse, which I hadn't really seen before, but it is starting to come through in some of my cases. Alpha agonists. We have two main alpha agonists that we would be using. And the way it works is it's blocking that norepinephrine or noradrenaline release in the locus coeruleus, which is a prime driver for emotional responses. We've got the two main ones, our lovely Cyleo, which is dexmedetomidine transmucosal. Prior to Cyleo being here, we were often just using the injectable version. People were finding that was actually working quite well, but not to the same reliable onset and not to the same palatability. It is licensed, and I think you'll be talking about it after my talk, for fireworks and thunderstorm phobias. But what we can do is use this for a client who has come to the practice, they've had the gabapentin on board, maybe their trazodone, they're still just not quite right, and we can't get close enough to them to be able to do what we need to do, which in my point of view with extremely highly reactive, aggressive dogs, all I need these drugs to do is have them calm enough for 5 seconds so I can sedate them. It is not to get them calm enough to do a full clinical exam and vaccinate. It can happen, but that's not something we should be aiming for or relying on, particularly for what someone would term red zone dogs. The benefit of this is they arrive, you can have the client sit out in the car in a nice quiet area, maybe go for a brief little sniff walk with their dog, ideally muzzle on if that's what they require, and then they would administer the Cyleo, and then half an hour later you can proceed with what you need to do, rather than sending them away and saying, come back tomorrow. Then we have clonidine. I love clonidine. It's great, but it's very variable in its onset. It's very variable in when it kicks in. And then sometimes we find it kicks in and then they're really, really zoned. So I love it once you've got that sweet spot for your particular client. I use it primarily for my hyperactive, explosive type dogs. And what we can sometimes do is utilize this either on its own, 3 hours, they would have it in the morning, come in for an early afternoon consult, and this may be the perfect dose. Now, again, trial and error. We've got to find out which dog is going to respond well to this. And as I'll mention later on, whether we combine this with other forms of medication. Once we're aware of where it's working in the brain, we can match these together. Obviously, we're looking at the side effect of sedation. Primarily, that's what we're probably after. There is the risk of hypotension. So the main thing I recommend with this is if you are utilizing these medications and then they're continuing with a further sedation or anesthetic, you want to get a blood pressure monitor on them and be aware of that. Be prepared for it to drop a little low and maybe alter the doses of top-up medications that you're using. I am open to any questions throughout it if you have to ask something. A little note here on administering these transmucosal medications. So we have the Cilios, we also have the buprenorphine that we would use occasionally, and I haven't mentioned it in today's talk, but you could use ketamine as well. Is teaching the owners how to administer it. Because if the first time they come, the owner's like, oh, I don't know how to do this, and the dog's already amped up and freaking out, and they want to get the muzzle on, and then they've got to put this in, it's not going to be successful. So a really useful thing to advise your clients to do if they have a difficult dog, and this is probably something you might be using, you're going to teach them to take yummy stuff from a syringe. I don't know what happened there. It has been flickering quite a bit, hasn't it? It's not just me having hot flashes. Yeah. Okay. And so generally we use this for a lot of species, actually. Really useful for birds, really useful, I think, for rabbits as well, is teaching them to enjoy taking things from a syringe, because then it's removing another of those triggers for a pet that's come to you for veterinary care. They're like, oh, I feel really scared, but every time mum puts a syringe near my mouth, I get cream cheese or ice cream. And so they don't mind that it's slightly odd, because 100 times previous they've enjoyed the experience. So we're going to have a successful administration of transmucosal medication. Also keeping in mind that it is transmucosal, not oral. Benzos, love my benzos too. They're not used as often as they used to be because we do have a wider range of adverse effects, unfortunately. What we're looking at with benzos is facilitating the GABA. So it's, again, similar to gabapentin, but calming down what is going on. We've got a few options here without Xanax. We generally resort to diazepam or lorazepam. There is clonazepam as well, but I tend not to recommend that in GP practice because it can really knock them out. I don't know if my colleague would agree if you've used it much. Whereas diazepam and lorazepam, it's, again, a little bit smoother. The downside of these is it can cause a ravenous appetite. Sometimes it's a mild increase. Anyone here ever used the IV diazepam to get a cat eating? It's not just an old school trick, it still exists. Good. It does. Potent appetite stimulation, again, can be very, very useful for increasing our use of counter conditioning and behavior modification using food. Now, it's routinely used, I think, or used to be used for your fireworks, for your thunderstorms, for your car travel and things like that. And if this works for your individual animal, it is beautiful. It is smooth, it is relaxing. You can use whatever anesthetics you want, really, but you often have a lower dose. At appropriate doses, it can facilitate retrograde amnesia, which is basically blocking them from forming really horrible memories. So that's why we often utilize it. If you have a fearful dog and they're really struggling with the surgical process, give them a benzo as part of their anesthetic or part of their recovery, and you find that they're a lot more relaxed and they're far less likely to have a unhappy emotional memory of their experience with you. So with these as well, variable onset, 30 to 60 minutes, sometimes 90 minutes. And then you've got that duration of about 4 to 6 hours. Now, some people prefer this if they've got the dose that works for their dog, because you don't have that gabapentin lethargy that exists for the whole day, or the clonidine heavy sedation. So it can be really nice, but you must test it at home. The other, at the bottom, our little paradoxical excitation. We tell people we're going to give them this drug to make them feel happy and relaxed, and they go flipping nuts. So you want to test it. If they do that, pretty much benzo is not the right call for that individual animal. Anyone here used it for like flying or going to the dentist or anything? Yeah, it's beautiful, isn't it? So good. It's lovely. But the point to note, obviously, this is more for individual doses. It can be abused by humans. So we have had people who steal their own pets' medication because it makes them feel good. SARIs. So this is our trazodone, serotonin antagonist and reuptake inhibitor. Basically, it's similar to our SSRIs, our serotonin, but it's less specific and broader in how it tackles our receptors. So it's going to effectively reduce more things rather than just serotonin. Now, this is why we see sedation with trazodone. I want to emphasize here that a lot of the benefits people rave about is a sedative effect, not an anxiolytic effect. So if we're relying on this, we may want to be combining it with something else that's going to tackle that anxiety as well as the sedation. So it's a beautiful addition, but I'm hesitant to say it's the gold standard, which some people were raving about for a while. It became very, very popular. It is, I don't know if it's not so much licensed, but they have done studies to use it for post-operative sedation. So I know a lot of our referral surgeons are now using it for those crate-rested animals. There are benefits, but we must remind ourselves this isn't because they're necessarily happier or calmer. They might just be a bit zonked out. Now, basically, we're looking at that sedation. You can see some ataxia at certain doses and the nausea as well. So it is wonderful, but we do have downsides in that it's potentially not as good for anxiety and it's expensive. So a good thing to consider, but not the be-all and end-all, which I think they were saying it was a couple of years ago. Now, I'm going to go off not so much the sedative, but if we're talking about pre-visit pharmaceuticals and using drugs to help our pets have a better experience, anti-nausea. How many procedures, how many anesthetics do we have where animals are actually quite nauseous and unhappy? There's even some evidence coming out that meropenem will actually help pain. So pain in the abdomen, pain in other areas. It's a miraculous drug, apparently, used for all sorts of things. So potentially maybe this is something you use. I know this animal's going to struggle with the procedure. They've previously had some gut issues, some nausea. Why don't we give this Cerenia, or I think Prevamax is our newer off-brand one, the night before or the morning that they come in. The benefit of the newer one is it doesn't sting so much. I don't know if anyone else has seen it, Prevamax. So it's meropenem, but not Cerenia. So it's not just can we drug these animals so they don't bite us, but are there drugs we can use to make their experience better? Opiates. Now, the reason I bring this up is a lot of our fear aggression and our unwanted behavior is due to pain. So yes, it manages pain well and can provide sedation. Obviously, we're looking at more side effects. We can have that decreased heart rate, that decreased rest rate, that sedation, that nausea, that constipation. But it's another thing to consider. And quite frankly, before we were using GABA a lot, buprenorphine transmucosally for cats was a game changer. It meant that you could potentially admit them, give them this medication orally or injectable, but if you can't inject them, in an hour or two, they might be a lot happier, particularly our older arthritic cats, who are not necessarily stressed, just really pissed off because you hurt them. Codeine, another option. Again, not something I would use regularly, but we're getting a sedative side effect. It's not great for absorption. We know it's not great for pain, but you can get that mild sedative. So this in conjunction with something like GABA might be an appropriate option. Fentanyl. Now, the reason I throw this one in here is if we're looking at animals that we struggle to medicate orally or we struggle to inject, there may be an option to apply fentanyl patch the night before they come in for some kind of procedure so that they've got that pain relief on board and they're a bit chilled out. I'll give a prime example. My mother's dog, who is a hypochondriac, nervous, freaked out Jack Russell, had an eye ulcer. Just an eye ulcer, but yes, I know they're very painful. And we really struggled to manage her. She was on Medicamp. She was on gabapentin. She was on all the topicals, and she hates having things done to her. They got to the point where like, oh, we're going to enucleate the eye. So I said, oh, well, to plan for it, we're going to put a fentanyl patch on the day before, 2 days before, I think. Miracle changer. She was so much happier. She still has her eye because we were able to appropriately medicate her with this appropriate pain relief on board that wasn't a nasty tasting medication, that wasn't something that gave her horrible side effects, slight constipation, but we could manage that. We still have 2 eyes. They are blind, but they're still there. Not from the ulcer, from pre-existing. So really, I'm just kind of throwing in other ideas that you could use. Now, I have to put this slide up because of the chill protocol, which we will mention. Now, acepromazine and melatonin are commonly used in a lot of the sedative protocols that people are using before animals come into the clinic. Now, hopefully you will realize that acepromazone is a tranquilizer. It does nothing for anxiety and in fact on its own will increase fear and anxiety. So we very rarely use it. I think most people are really removing it from their anesthetic protocols as well, but it still exists. I personally do use it in my pre-euthanasia cocktails to put them in a happy state before that final injection. But on its own, it is not appropriate. And I'm not a huge fan of using it in anxiolysis prior to coming into a vet clinic because all it is doing is sedating, and that isn't necessarily what we want to achieve with these medications. Melatonin. I wasn't a huge fan of this, but in preparing for this, I did a little bit more research, and I'm actually quite excited about the potential around this. So it is primarily used for sleep disorders in all species. But we are seeing more and more evidence for anti-anxiety effects. So again, this could be a nice additional cocktail to add into what you're using. Obviously, as I keep saying, individual dogs, individual responses. I do not know of its use in cats, but I understand it is used. Do you know? I keep referencing to Emma here, who is another veterinary behaviourist. So nutraceuticals doesn't have to be drugs. None of these are miracle changes. Has anyone had a good experience with the particular nutraceutical? Anyone think, oh, that really, you were just saying pet rescue? Which works for rabbits as well. Yeah, which is useful. I didn't mention that, but that is an option. They're not amazing. They tend to be too expensive for the benefits you're getting from, Amy. Love it. Probably not so useful for a pre-visit. So, yeah. I love Royal Canicum. Yeah, no, I do. I love it. And that is L-theanine and alpha-quercetin and a few other things in there as well. Really? Well, she was a pre-existing psychopath, but this is her teenage blue healer. So
You can't stop the dog running around the lounge.
yeah.
About 20 minutes of having the children.
Wow.
You're kind of like, what the hell?
There might have been something else in there that did that, maybe the B vitamins. But these are options. So you might have clients who are like, oh no, I don't want to drug my dog. You've got other options, but keep in mind things like your complete calm, your tryptophan, your L-theanines, they're more targeted for long-term treatments. You're not going to give a tablet and have them great. Any of the nutraceuticals, I think, and I think Carmex is the one I've seen the most response to, but not in a good way. They just get really sleepy, but they're not really happy. These are options. They're out there. I'm always open to, hey, does this work? CBD is at the bottom there. We do not have enough evidence yet to say yes or no. I think it is looking very promising, but every time we get a new study come out, we're like, equivocal. I'm like, I want good news, but it's not there yet. And as vets in a science-orientated profession, we do need evidence to back up our recommendations. Pheromones. I love pheromones. I've been raving about Adaptogene Thalliway for a long time. I'm glad they're not here because my line at the bottom is limited, robust science. Anecdotally, I am very happy with it and I will utilize it in all of my low stress handling, and I feel confident that I see a response to it. Now that's level 1 evidence. There are other papers out, obviously provided by the company that makes it themselves. It doesn't do anything bad. I've not seen any adverse side effects to this at all. And so I'm a big fan of using it on its own, and this is where people fall down. Again, their expectations are like, oh, I bought that Thalliway and it didn't make any difference, and I gave my dog Adaptog, it didn't make any difference. You were expecting the wrong thing. And it's a good adjunctive to use in addition to the medications that I have just mentioned. Topical pharmaceuticals. A lot of people are forgetting about this. If we want to go the rabbit there, if we want to be doing things that reduce the stress, this is a game changer, again, without a doubt, but you've got to plan for it. So we have the 2 main topicals here in New Zealand. I don't know if anyone knows of any others. Emla, onset, it takes 30 to 60 minutes. In the studies I was reading, that it needed to be at least 60 minutes for it to be effective in a dog, less so in a cat. So if you're putting it on and 10 minutes later trying to put a catheter in, it's not going to make a difference. Exactly. If you want to optimize its benefit, time it right and cover it. Yeah. Exactly.
So what I find the best thing is to get back, put a square down, put your adhesive plastic cover on the bed, put the cream in there, put the ear, put it on and strap it down the bed. So I find that works much better than trying to make some sticks in and then on the dog.
Yep. Thank you. Very useful. Practical tips. I love it. But we should be using more of it. What was brought up in some of the studies as well is that it's very useful for venipuncture, less so for catheters, because the actual movement of the catheter is not being affected by that topical edema. So it will help for the initial, but you can actually do completely no restraint cat venipunctures with just this, or your other vet pharmaceuticals, so that they're happy. It's possible. We do not need to, I can't use the term manhandle anymore. We can't be rough. We don't need to strangle these cats to get what we need. They can just stand there and lick a dine and you can take the sample. It can be done with dogs as well. I did mention xylocaine gel there as well. It's readily available. I don't find it as effective. I think it simply doesn't penetrate as well. Supposedly the onset is faster, but most of the studies are relating to mucosal surfaces. So it's primarily used for internal examinations and passing catheters and things like that, less useful for penetrating the skin. But why are we not using them more often? We should be. And if we need to charge the client for that, then we should be doing that, because this is going to prevent all those blown veins and save you money on catheters and blood drawing utensils. Anyone using them much? Yay, good. Actually, I'm really pleased. Thank you. I thought I was bringing something new to the table. Multimodal combination. So here's how we're moving into, we've talked about what the drugs are, but on their own, maybe they're not enough. I don't personally like the chill protocol. When it first came out, it relied on melatonin and ACE promazine. I don't like it. I think it was relying far too much on sedating away the behavior, not making the animal feel better. There is a modified chill protocol, which I think we see more benefits from, which is incorporating gabapentin and trazodone, and then that transmucosal ACE promazine. Keep in mind that the ACE promazine, as the protocol dictates, is transmucosally. I know some people have been using it as a tablet, far less consistent as to when it's going to kick in and what it's going to do. So I'm not a big fan of it, but I did want to mention it because that's probably one of the more common questions. What's the chill protocol? What do you think of the chill protocol? I'm glad it was created because it brought to the attention of vets that we should be looking at using drugs to help our animals cope with the stress. The other drug combos that I do prefer, gabapentin first and foremost, and I use gabapentin, but I mean pregabalin and gabapentin, plus trazodone. Gabapentin plus clonidine is probably my go-to. And now we have gabapentin and Cilione. So we don't have to use just one drug at one dose to do the trick. We can play around, we can work it out. Now, as I mentioned with using clonidine originally, I use that for the really explosive dogs. So I've often found people come and say, oh, we gave him 1,200 milligrams of gabapentin and it didn't touch him. And if we go for a lower dose of GABA, but add in that clonidine and appropriately dose it at the right time, we get the perfect level of chilled out and happy and not explosive, which is pretty much what we all want. Does anyone have any other combos that they're using at the moment that they'd be happy to share, or? Okay. Yes, it's called Catapres. The only downside is it's a human medication routinely used for hypertension, and they're tiny tablets. So you might have, I've got a big 40-kilogram dog who was an attendee at his guardian's wedding, and he had 10. Yeah. They're small tablets, they're easy, they're not cheap, but they're not as expensive as trazodone. Catapres, you can get it from any of your vet suppliers. Yeah. So post-operative, this is where we often forget, okay, I've prepped the animal so it's happy, it's come in, it's had the procedure. Keep in mind they're still learning and they're still having emotional responses to their experience in our hands and in the vet clinic. So mentioning those benzodiazepines with retrograde amnesia, I think Emma and I both love midazolam, either as the pre-med or a post-op. Love midazolam. Yeah, she's like, yeah. Gabapentin, so I know more people are using now, which is great, but often it was go home with anti-inflammatories. But hey, maybe gabapentin is going to be that nice addition for their post-operative pain management. And you've got that anti-anxiety component. We've got the trazodone, which is routinely used by our surgeons, something to consider, and opiates. And again, I'm cautious with recommending opiates because it's not the right call for many, but it is an option that you want to have in your back pocket if that's the appropriate post-operative plan. Be that fentanyl as a patch for a difficult dog. Yes. Yeah, some people do. It might come into your routine. If you want to make it normal, you would put it as part of your pre-med, or your nurses know as soon as I'm putting that last stitch in, I want you to give them midazolam. It doesn't really matter. I think the only reason not to give it at the beginning is if you have an incredibly long surgery and it's then worn off. We're looking at like 2 to 4 hours optimal effect, I think. Am I right? Or am I longer? Injectable? Yeah. So yeah, it's something, it's definitely something to consider. And I will often use it in my pre-med for animals who are I look at you and you're worried, you're really, really worried. I want to make you feel better as soon as I possibly can. And so I utilize it in the first one, in the pre-medication. It can be given, it's recommended IM for optimal onset and effect, but I frequently give for my nervous animals subcut. It'll still get there, just have to wait a little bit longer. Yeah, so there, and the opiates. Where are we up to? Now, medication, as I've said a few times, it's not the be-all and end-all. It's not the quick fix. It will only work if these things are included. Test the doses before they come so we know the time of onset, we know the duration, and we're happy that there are no adverse effects.
and that we have the right dose, because too many people use it and then test it. So they give the drugs and then they do something scary to the animal. And that's not the right way for us to know if it's worked. If we find, okay, I've done it and I'm happy that they are relaxed, they're chilled, they're like breathing well, that's when I know I've got the dose that I want to use. If they then become further terrified with what I'm doing, we need a different game plan. And it may not necessarily be the dose of the drugs. It could be a different way of managing them. I haven't mentioned, but I want to, if you have an animal with veterinary fear, there is usually a level of generalized anxiety there as well. And so if you have a dog that is really not coping or a cat that is really not coping, you might want to ask a few little questions. Is there something else going on in their life? Do they actually need more long-term behavioral support? And that's where your long-term nutraceuticals, your referral to a behavior vet, or looking at your SSRIs will allow these pre-visit drugs to be far more effective because we've got their baseline anxiety in a much better zone. You must be using these drugs in conjunction with low stress handling techniques. We can't expect them to tolerate horrible handling just because we've given them drugs. And I flip through, confirm if other behavior concerns need to be addressed. So if you have a vet, an animal that is worried at the vet, there's usually something else. They're worried about fireworks, their dog reacted, they are grumpy with the other cat in the house. And if we find we've got 2 or 3 areas of behavioural concern, we want to start looking at their overall behavioural and mental health. And we want to manage those clients' expectations. Too many times they're told, oh, I'll give you these drugs and your cat or your dog will be fine for the next visit. That's not true. So what we need to do is explain to them what we're expecting from this. And one of the easiest ways to do this is have a little handout. So you either email or you give them this information. You have been recommended to utilize pre-visit drugs. This is what we would expect. Call us if this does or does not happen, so that they know what they need to do and what they need to expect. Otherwise, the number of times where it's like, did you give the drugs? Oh, no, I forgot. Or no, I haven't tried it. Oh, we're doing the procedure tomorrow and I haven't tested it. You want to be proactive and make sure they know what the plan is. Client education, client consent. It will also help if there is an adverse effect. They're not going to hate you because you've explained what's going on and what we expect. Now, because this is not a talk about the whole low stress visit and such like its drugs, I do want to mention muzzles. And this tips into the handling of animals and the training of animals to accept veterinary care is not necessarily the veterinary clinic's job. This is where the clients need to be taking on board the responsibility to help their pet cope. So with muzzles, obviously we use them frequently in the vet clinic, and we're usually using them wrong because we're shoving them on the animals because we're forced to do so because they're a bite risk. I have sent people away and said, we're not touching your animal until you have muzzle trained it. So we have a very short video here with a lovely accent that you can't hear. Oh, I didn't consider that. I'll talk it. It's not as sexy as the South American one. You can see the videos. Basically what we're doing with muzzles is we are providing a piece of gear that the animal elects to be involved in. We do not put things on the animal. And this is where we emphasize that the animal will have their own muzzle, not one that has been smelt of other dogs or smelt of cleaning chemicals that we have put on them when they're already stressed. If we have an animal that we know is worried, the client will go home and teach them to love their muzzle. Muzzles do not mean your dog is a bad dog. Muzzles protect everyone, and we want the muzzles to be something they enjoy. Muzzles should be basket muzzles. The fabric muzzles that are frequently seen in vet clinics are either not effective, uncomfortable, the dog can't breathe or pant or do any of the things to reduce their physiological state of stress. You can't feed them treats very well, and worst of all, they can still bite you, but they can't let go. So simplest thing, and you could have a little handout that you give to clients, or you can direct them to some very useful websites. This is the Blue Cross, who have some amazing behavioural videos in the UK. Muzzle Up Project has a range of videos. They're a little out of date now, I think. I think they need to modernise them. And the Muzzle Movement. And he talks about it so well, but we are offering a muzzle, providing treats in the muzzle through those lovely holes. I do like to point out, you can see these basket muzzles. There's a big hole at the bottom and the big hole at the top. You want to feed through the bottom because that's how they will then scavenge off the floor if you have scattered food for them or you've provided them with a licky mat. They can't lick through their nose. So we've done that. Now, some dogs may have had an unpleasant experience with a muzzle, with you or with someone else in the past, in which case the first week might literally be the muzzle is on the floor and there's pieces of cheese next to it. We are trying to give these animals a degree of autonomy, a degree of choice, that they can make decisions that are beneficial for them and they're not vulnerable to us forcing things on them. So there's three main stages of the muzzle, really. It's them putting their nose in to start with. There's the movement and the feel of the straps and the sound of the click and then the fact that it doesn't come off. And all of those stages need to be worked on at home. So I'm sorry we don't have the lovely talking that explains it, but hopefully we've at least emphasized that muzzle training is something we should be recommending to far more clients. And in fact, if you're running puppy schools in your clinic, you should be recommending that they include muzzle training as a component to basic dog management and handling. That was Blue Cross in the UK. They have some, was it? That was Blue Cross? Yeah. Because there's a Battersea, what was that Battersea? There's Battersea, Blue Cross, there's a few. I love the UK. Sometimes. So did I. Yeah, I not for 10 years. I worked at the Blue Cross in Victoria State. Like, oh, that was insane. It was like 5 stories high, and they had like an entire radiology floor. I know, it was amazing. Not so helpful. I posted this up here. A colleague of mine in Adelaide did her PhD on this, understanding what causes stress. This is a handout you can download and give. I won't go through it all, but if you Google Adelaide and my dog is scared of the vet, you'll find this information. So a really useful overview of what people can do to reduce the stress of their animals. And it's backed up by evidence. There is a component. So there have been studies in regards to, is the animal better to stay with the owner or not? And this can depend on the behavior of the owner. More often than not, the animals are safer with their owner. They feel more secure. But if you have elevated anxiety from a particular individual, the dog may be better away. But what we need to be aware of is once they're away from the client, are they shutting down and actually progressing into a learned helplessness state because they're too afraid to do anything? Or are they less anxious because they don't have that contributing weirdo in their life? So it does come down to fine-tuning your understanding of recognizing the behavior and weighing up the pros and cons. Okay, this is a procedure that I need to sedate this animal because they have a broken leg. And I can't do that unless I've got them away. So as much as I hate it, I admit that veterinarians do utilize the learned helplessness and the freeze state to allow us to do our job. I'd like to move away from that and make those situations far less common, but it is an option. I tend to be careful with client education. When you say, I'm going to take them away because you're making them worse, is not a phrase we would use, even if we're thinking it, because you want them on board to help with future and they need to trust you. And so a lot of the conversations I'll have with people is not what they're doing right or wrong, but, hey, can we see that Fluffy is scared? I have an idea of what we can do to help that. And then it's not laying blame and it's not telling them that they're inadequate or making it worse. So yeah, I wish they taught us more about human psychology. So we'll throw in this here. Well, it's okay to say no. You can look at this pet and say, this is not happening today. And if it is not urgent, because it's not an emergency medicine, whole other ballgame. Any emergency vets here? Yeah, I've done it for a while, but yeah, it's a whole other ballgame. But yeah, you don't have to do it right now. You can say, no, go away. I'm going to give you some drugs. I want you to trial it. And if we're all good, we'll come back tomorrow. There is the other debate of the boss saying, no, you can't. Are you going to charge them for that visit because they came? And this is where we need to advocate that there is a clinic policy about reducing the stress and anxiety of our pets. You're going to send them away to do it another day. You're going to use medication and you're going to at least attempt some form of muzzle training so that the owner, the client is coming in with an animal that is less of a threat to you, because there is a very real threat. And I know a lot of vets who are terrified of certain breeds of dogs. And their behavior aggravates and intensifies the anxiety of that dog. When the dog comes in and it's already muzzled and the owner has a good handle of it, the vets will feel more comfortable and therefore more able to do their job without intensifying the situation.
If you just suggest we don't charge If we spend the same amount of time with good history, visibly watching it, walking around and doing things, if you don't actually physically touch it, you're saying that you.
No, that is a consult. Not the majority, but a large percentage of my consults, I'm behind a fence, looking at them from a distance.
Right, okay, let's do that.
But if you see them come out of the car and they are exploding and they are peeing themselves and growling and bark or whatever it is, am I running out of time? No, okay. So then you can turn around and say not today. But if they have come in and you've got to a point, oh, they tried to bite you, you've still done a consult. I would charge that. They have still reaped the benefit. Yeah, we love our car park consults.
Maybe to you.
Yeah.
I still charge the consult.
If you have consulted, if you have, and yeah, absolutely. But if it's a, we're just not even, they're not even getting out of the car, then and that's the art of determining what is appropriate. But if they have benefited from your observation, diagnostics, and recommendations, that is a chargeable consult. Yeah. So I'm going to do some blatant self-promotion now. We have 2 opportunities coming up, not 2. This is an ongoing opportunity. I love this course and I love Angela for creating it. This is helping pets with vets. So this is teaching clients how to introduce their vet to all the handling that they would need. It's suitable for grooming. It's suitable for pets with handling sensitivity. And it will radically change that pet's experience of veterinary experience. I've had a busy week. Radically change how they deal. And I've seen miracle turnarounds, dogs that you couldn't touch that were exploding, no medication necessarily, but just this course, they can come in, they can sit wearing their muzzle, do a chin rest, you can take a blood sample, you can vaccinate them. I think Ellie will advocate for that. We've had a few of our dermatology clients who come back to it. Not enough people are taking this up. And even if it wasn't my business, I would still be recommending it because so many pets struggle with veterinary care. There is a solution. Yes.
So I've been trying to recommend it because of the expectations of the client of how I'm going to handle the dog and how long I'm going to take the dog after your course.
This is where.
Is that a real concern or not?
No, because it is emphasizing to them their responsibility for what they need to help keep it. It's a team. You're doing the vet stuff. They're doing the training stuff.
So just so you know, I have my own dog, as the course is that one. Just one because I've got a problem at the top, and so there's no anxiety, with all this pretty hard with it, but, 2, I want to use myself, if I'm going to recommend to clients, what I would go through the clients, and also not knowing the other side. It was the best course I think I've ever been in my entire life of behavior. And I can obviously really know what we're talking about. And I love behavior, I love children, all that kind of stuff. Through my mind, the kind of stuff I got my dog to do. She's so anxious with this stuff. I can get any ear dog in there. The other day, she ripped her toenail. I wouldn't, I could do everything I wanted to do. I mean, obviously I was stay to do it, but I could take advantage of her time. I can see it. So I highly recommend this course. I highly recommend doing one.
Thank you so much. So no, I know. I didn't at all. I mean, I'm in awe of what Ange can achieve, without a doubt, with so many of my clients. And I think we're saying every individual animal will respond differently. And one of the benefits of Ange's expertise is she'll grade it for what they need and what they're working on. Some will come and they're already more advanced than others. But they're all going to come away with a massive improvement. Yeah. So obviously I would recommend more vets do it and more nurses so you know what it's doing. You could even start incorporating some of these skills and mini lessons with your clients. But it can make a huge difference. I think with anything, there's never any promises. We don't offer.
I've been using the simple saying.
I know.
I've lost count of how many people are listening, but have any of them needed to work?
I think once we couldn't run the course, but we're usually having 1 or 2, but not enough. And I really value that you guys are. It is a little bit. We just need a satellite clinic, I suppose. But I mean. I'm not sure for classes whether we find out where they're from, but yeah, I mean, I do need to get a system to let you guys know so that we can reward you in some way for supporting us. But
It's like, do you want to see records to help?
not for these necessarily, no.
No, but just, I'm recommending.
It's such a wonderful course. It never existed before we created it, and I'm really proud that it exists, but more people need to recognize the benefits of it. And this comes down to identifying to clients that an animal that's struggling with a vet, we can do things. We've got drugs, we've got ways of handling, and there's a course you can do for you to learn to be part of your pet's training, because cooperative care, which hopefully you've all heard about now, cooperative care, consent-based care, is not something you introduce in a vet clinic. This is something the clients must go home and learn and train.
Is there a website that you can find more information there?
Absolutely. Kiwi Vet Behaviour. Easy to find us. Our social media regularly updates on courses and such like coming through. I hope I'm not hijacking GLA with this, but it is a component to what we're talking about today. So even if it's not us, there are online courses that clients can do as well. But I'm really proud of what we've produced.
That one, that's at school on YouTube.
Oh, okay.
Like the brushing, for example.
Cat Friendly has a lot of that as well, which is nice and easy to find. So we need to just do another evening like this and talk about all the other things that we can offer. Yes.
Do they find suitable dog?
Yes. Yes. So we have I don't know if many of you have been to our centre, but we're set up in a way that we can actually barricade and isolate people in separate rooms if they have a dog or a human reactive dog, which is helpful. And occasionally they're not suitable for a group class, for example, which Cass Ange can do one-on-ones. And you may have seen our recent, if you do follow us, Boogie, who was held she was just held up dangling to enable them to do a rabies vaccination because she was traveling overseas. And then she came and saw Ange 4 times, and this dog was just a game changer. I could do a full clinical exam with no medication on board, evaluate her, and she just went in a plane to the UK and she was fine. So
Tell me
yeah.
about those things. People are using the penguin pills for flipping down
Yeah,
and
yeah.
and stuff.
Yeah, it's generally frowned upon in the behaviour world. Yeah.
And what I say at my clinic is just being ignored. So, I prefer the longer winded desensitization and training that would help
Yeah.
with fear.
We also do a nail care workshop. Because there are all these huge issues out there, and it's not just go to a trainer and fix the problem. There are ways of helping our animals cope better, and we just need to make that more available and emphasize to our clients that they should be doing it. I mean, if they bring an animal into their life, they have a responsibility to protect their mental well-being and allow them to have access to essential veterinary care and pedicures. Yes. Yes. Oh, sorry, I didn't talk about that. So a lot of people are very worried about trazodone if they're on SSRI, or if they're on tramadol or various other opiates as well, and that slight risk. The risk of serotonin syndrome is very slim, and the majority of cases is purely from inappropriate ingestion where they've eaten their owner's tablets. Very rarely does it occur from us medically dosing. So I'm very happy to give both Fluox and trazodone together. Obviously, I err at a slightly lower dose potentially, but it just, my emergency colleagues and my behaviour colleagues all agree it's not. Massive dose, yeah. And they eat their owners. Yeah. So yeah, this course, there is help, and I think more vets should do it because then again, as Justine has done what you're recommending. Yes. Yes.
And take them down the road and maybe bomb that.
It's a good idea. That's brilliant. I love that you're catering for how they might experience about it. Yeah. 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 I mean, even just they've got a pre-existing nausea that we didn't do to them, and they come in and they feel sick. I mean, it's amazing the number of dogs who do tolerate coming to see us again, given what they've experienced with us. Ameliorating that is probably quite tricky because you've had them vomit. We can't necessarily give them something to reduce their anxiety. But what you could do in that respect is utilize something like a Dactyl. So you'd spray something on a little bandana and send them home with it that time and say, hey, they've had a really bad time today. Why don't you come back and do what we call happy visits?
was the one I remember, that was on the private.
Yeah.
And then,
He may have had an unwanted effect to the opiate aspect of that as well. So a disorientation and other nausea and yeah. I mean, it's similar to humans. Some people are more resilient than others, and certain emotional events can be more traumatic. Yeah. So you can, if they've had a bad experience, you can absolutely do things to help change that. But it tends to be slightly slower. Yeah. Well, see, that's where after they've had that, probably I wouldn't be adding in a benzo on top of that experience. And although we imply and rely on there being a retrograde amnesic, it's not specific. So it's not a guaranteed outcome. It's just an optional extra. I love all these questions.
With your course, because I have a slightly, I can't even.
Fine. That's all right.
How many hours are you normally? What kind of-
So we run it on Saturdays. It's 1 hour for 6 weeks.
In the morning?
Morning. Usually morning, mid. It depends on what else we've got booked in. Ange, is that right? Midday. So yeah, and the nail workshop is just a 2-part workshop. So you do the theoretical and then you come in and do a practice session. So if that's your specific target.
Just in terms of time, we'll
Oh,
take
sorry.
some questions at the evening, so.
Oh, they've still got lots of things to talk about. I'm more than happy if you have specific questions. Feel free to yeah. See, I told you I'd mention you. Contact us. We are also running, if you know, in May there's going to be an arthritis awareness and a dog anxiety awareness month or week, and National Pet Week. It's a big event. There's a week and a day for everything nowadays, and we're going to do a wellness day where I'm going to talk about the role of chronic pain in behaviour. We also have Marianne Smith, who is a masseuse who comes and massages dogs at our centre every fortnight, and the wonderful Ali Clark, who will talk about the role of derm and pain and wellness and what we can do. So quickly moving there, those are some of the references that I've referred to and got my information from. I actually have a copy of them here if anyone wants to peruse through it, and we're done. So if we have time, I'm happy to take a couple more questions, or yeah. There were some more raised hands if you wanted to ask me something. Yes. Yeah, oh, routinely. Yeah, I do myself as well. Good to know. Thank you. That makes sense, actually. Yeah. So metoclopramide as well, for the anxiety side, I wouldn't be using it, as I mentioned, meropitant for anti-anxiety, because it affects the brain. It can make some animals be a little doolally. No, I've very rarely seen it, but it's a credited risk. Yeah. Yes. Yes. There are various ways to assess it. There's certain surveys that people send out that have different ways of asking, and this is where, you know, there's a whole science of creating surveys to determine, do they think this? And then sometimes you'll educate them about what fear and anxiety looks like, and then ask them the same question at the end of that course, and you might get a different answer. So I know the Fear Free website will have information as to how they got those numbers, but most of the studies I've seen are around anywhere between 30 to 70% will come back and say my dogs were worried, and I think that fits with what we all probably see ourselves. Yeah, but it usually comes down to, because the client's perception of their animal's behavior isn't necessarily what the animal's behavior is, because I would probably say there's a higher number of stressed animals, but the owners do not see it. Yeah.
Totally, which is good.
All right,
Wonderful. Thank you all for your interest.
So we'll have a bit more time at the end for some more questions.
Okay, fabulous. I'm gonna refill my water.
Yep, cool. All right. So yeah, that was a fascinating talk. I was blown away by the fact that puppies and kittens, when they come in for spaying and neutering, can be affected so badly. It was it seems logical, but yeah, something after however many years in practice I hadn't quite considered. So yeah, I will talk to Jess. I see heaps of people taking photos and things. So if Jess allows, we can get the notes sent out to you. Yeah. Cool. So I just wanted to quickly just talk about our behaviour portfolio. So we're just developing our behaviour portfolio now. So the two main ranges are Cilio, of course, and we have a pheromone range that we've just freshly launched. So we've got both the cat and dog pheromone. We also have a rabbit pheromone, and they come in a collar, a spray, and a spot on. We will have diffusers, but they will be a bit further down the track. So certainly look out for those. Just a quick recap on Cilio. Jess has talked quite a bit about what it is and how it works, so I won't bore you with that detail again. I think the critical thing, though, is it's the same drug as Dexdomitor, but it is a different formulation and a different route of administration. So essentially, what you get when you give it oral mucosally is only a 28% of the bioavailability. So you get, essentially what you're trying to achieve is a subsedative dose. You're getting anxiolysis without the sedative effect. So it is quite different to using Dexdomitor, particularly orally. It's got to be oral mucosal. It is tasteless, so it doesn't have a flavour. It's not palatable, obviously, for a reason, but it also equally doesn't. It's not bitter. It's not resisted when given. But the critical thing is that oral mucosal administration. And for those dogs that do bite, it is actually easier to give once they have the muzzle on, because you don't have to get it into the mouth. You just have to get it between the teeth and the lips. So.
I actually tried to find a video of that, someone administering it through a muzzle. I couldn't find anything, and
Okay.
I was too late to
I will.
the video myself.
Yep, righto. I will. Something we can look at. So just a quick thing on when to administer Cilio, whether you're using it for noise anxiety or preclinic visits, preemptively, so 30 to 60 minutes before the anticipated stimulus, when the anxiety starts, so as soon as you notice the dog's anxious, or when you hear or see the dog is going to be stimulated in a negative way, so when you hear fireworks or as you're bringing them to the clinic. So dosing with Cilio, so it's a 3 ml preloaded syringe. These are the syringes here. We have lots of these dummy syringes, so as Jess said, training the animals at home is really easy with these. Peanut butter, I understand, goes quite well and gets the dog used to it prior to using the Cilio itself. And it's a what do you call it, a locking nut with a dot, so each dot is 0.25 mils. There's the dosing chart. You can use it up to 5 times in the same event if you're using it for noise anxiety, with 2-hour intervals between the doses. It's got a 4-week shelf life, and storage is just a simple room temperature storage. I think it is also worth pointing out, someone mentioned cost. I think it's around, you'd have to check with your specific wholesalers, but it's around $43, $42 to you guys. So for a 20 kilo dog, that's roughly 4 doses, it's just over $10 per dose. Obviously for those big dogs that are going to use the whole lot, then it is significantly more expensive, but then every medication is that you use on those bigger dogs. So yeah. Overdosing, we do get a few queries on overdosing, so it is possible, but it is difficult to achieve. So the worst case scenario is you give somehow your little 2.5 kilo Pomeranian or something gets the full dose oral mucosally, so that's 300 micrograms of dexmedetomidine. The worst thing that happens is the dog becomes sedated or may become sedated. You can of course reverse it with antipamazole, so it's pretty simple to avoid that. So that's Cilio in summary. So I'm just going to hand over to Kim now. She's just going to hobble her way up here and just talk to you about some of one of the new products we've got. Just a couple of minutes, and then we've got a quick quiz. And then if you've got any questions for Jess, we will take you through those. You right there, Kim?
Yeah, I might not be able to get up there though, hey?
No.
All right. You just might not be able to see me.
Do you want me to? I can move the.
Actually,
Come around this side.
no, that's okay. I'll stand off to the side. Is that all good?
Okay. Yep. Oh.
How am I going to change the thing?
Oh, I can do it.
Sorry, guys. Been out of action for a month. It's my first big night out, so. So I just wanted to really quickly just skim through a couple of our new ranges. So the veterinary oral care range is a Plactive Plus range that we've just got in, or we've had for a few months now. It's a veterinary exclusive range, and it is probably, I believe it's the only full range of dental products in New Zealand that has the VOHC approval. So it's got the 4 products in the range. Plactive Plus has a patented explosive technology that's clinically proven to reduce tartar. So we've got the water additive, oral spray, dental wipes and the toothpaste, so that's the range. So it's basically a plan for every pet that comes into the clinic. The VOHC approval on the water additive has been proven to reduce the calculus or tartar by 21% in a 12-week study. So it works very well. There's also the oral spray, which is quite good for puppies and kittens, or puppies coming into the clinic, just starting off on a treatment or dental program. The dental wipes is quite good because you can just wrap it around your finger, or the clients can just wrap it around the finger, using that instead of an intrusive sort of toothbrush to start off with. Toothpaste is proven to reduce tartar by 37%, and it is known to be the gold standard, obviously, in dental regimes. So that's pretty much the range there. We do have some nice, do you want to change this? Thanks, Pete. We do have some nice new stands that we've just had made up for the clinics. We've got a special roadshow promotion at the moment. You're just purchasing one of each product to go in the stand, and the stand can sit nicely on the countertop or the shelving in the clinic. So that's available from now. We've just had that made up this week. It's available through SVS and Fortis at this stage. We're just working through those 2 wholesalers at the moment. So there is, in your little goodie bags, there is a toothpaste available that you can try in the clinic and show people, and the order forms there too for you. So I think that's that one. So as you can see, our range is significantly grown in the last sort of 12 months. We did just have the Derm Care range of shampoos, including Meliseb, in our portfolio, and over the last 12 months it's grown quite significantly. We do have ranges in dermatology. We've now got our Nice Behaviour range with Cilio, and the Pheromone range is a generic range to compete in the market, well priced for rabbits as well. We have a pheromone spray for rabbits too, cats and dogs. Sorry, I'm conscious of the time. So yeah, I think that's, also, if there is any products that you're interested in that you're aware of products overseas and you maybe can't get them in New Zealand, we're always willing to have a chat to you about that. Pete's always trying to source products to add to the tackle box in the clinic. So, yeah.
Working on it.
Yeah. So do come and approach us or talk to us when I come out to clinic when I'm better. Do let me know if there's anything that you're missing, because we're always, like Pete's always on the case. So do let me know. So our YouTube, we've got a GLA Farmer YouTube channel now, which is pretty exciting. Up with the times now, we're moving with the times. You'll see Dr. Pete on there doing lots of training modules on dental, behaviour, some training on the Cilio. What else have we got on there? Shampoos, how to shampoo and what's good for shampooing and things. VOHC approval and what that means for the clinic and for the clients. So that's the first thing. We've also got a Facebook and Instagram page now, so do try and follow us, because that will keep you up to date with any programs or events that we're running, any new products that might be hitting the market anytime soon. So yeah, so I think is that pretty much it. Yep. So have you got any more to go, Pete?
Yeah, no. So that's us. I just first of all want to say thank you very much to Maureen, Ian, and Chris for helping organise the evening. Thank you very much to Jess. That was a fantastic talk, and it's Yeah, incredible how far we've come in 25 years. When I graduated, Xenocarb or Rimadyl was just being launched, and that seemed like a big leap. But yeah, certainly, yeah, I think we've come a long way, and it's great to see. And thank you very much for attending and for supporting us. We are a small company. Just as an aside, the GLA stands for my three daughters, so Grace, Lucinda, and Alexandra. So we are a small New Zealand company, and really appreciate your support. So the more you buy off us, the more we're able to help in terms of bringing in. We're also a silver NZVA sponsor. Being a past president, I couldn't resist supporting the association that I love and the profession I love. So just really thank you for your support and those products.